Hi, I'm Dr. Viv Rolfe. I'm a university science lecturer, and this is the second part of two little resources just introducing ethics and what you might need to do for your undergraduate research dissertation. Okay, so this is part two, and I've seen a whole range of research dissertations in the sciences. You might be going from the blue, which is a low-risk literature review that might not need any ethical approval, to yellow. So they're surveys, they're qualitative analyses, they're interviews, but you're using personal data, so there are ethical considerations here. But as we go round, if we're using animals and if we're using human tissues, there are some quite serious laws and acts we would need to comply with. So the Human Tissue Act, for example. But if we went round further and we're actually dealing and working with human volunteers or even patients, we would need to go through quite rigorous ethical review processes. Okay, so I think that's quite a nice flow that shows you might be doing something low risk, but actually there's a really good chance even doing a survey you would need to go through your university ethics process. So this is what it might look like. So there'll be a ethical review form. The form will be sent off to a panel to review, and then you'll get some feedback which might say yes, you can go ahead, or no, just modify and give us a bit more information. And what's clear is it's absolutely vital you can't proceed with interviewing a person, with doing any exercise physiology, for example, or using any patient data until you've got that approval. So this really is a serious process. There might be additional paperwork you need, and on this blog you've got the actual items, so some draft items for giving patients information, a signed sheet, and a little checklist as well, an ethics checklist. So if you're doing your research within the university, you're probably okay. If you start going outside into the community, depending on where you are, there might be different codes of ethics. But if you're science and doing health sciences, if you're out in a hospital or care setting, you will absolutely need NHS ethical approval. Your first port of call will be your hospital or local care authority research and development office, R&D office, so they will help, and then they will point you towards the ethics, the National Research Ethics NRES website there. Now that is a long process. I've known that take up to 2 years, but you will have academic support, and if you are out in the workplace, you will probably have a work-based supervisor, a nurse, a consultant, a clinician working with you, and they will be familiar with these processes. So yes, they are demanding and scary, but you will have lots of support, okay? So our university processes are quick, might take just a few weeks, but NHS ethics, depending on how complex your work is, could take a serious amount of time. And these are those key terms that we must comply with. So informed consent, so we're giving patients and participants clear information on our information sheets. They know exactly what they're letting themselves in for. They have their right to withdraw, and all this is really important to consider. We need to think about confidentiality, either keeping data completely anonymised and ensuring our personal data is protected, and this must comply with the UK 1998 Data Protection Act. There might be other research requirements. So if you're working in the lab, do you need COSH to ensure the safe use of chemicals? Do you need to risk assess the use of any equipment, for example? I'm flying through these slides, but you do have them available to read for yourself, so you can certainly do that. And I think you can stop and start this presentation. So where does that fit in our whole planning procedure? So really the ethics comes first, and you can see as we go left to right through those boxes. Very much in your planning stage, you need a proposal, you'll need your associated paperwork, then you'll go through review, then you'll conduct your research once you've got approval. And then when it comes to writing up, you need maybe a little line in your methods section saying, yes, I've got ethical approval. If you were publishing your work, you certainly would need ethical approval to satisfy the publishers. So hopefully these resources have helped you understand what ethics are all about, and importantly, what you might go through as an undergraduate student. And I'll leave you with some further links. So to Henry Beecher, who first started to talk about ethics and the need for informed consent, a link to some of the Hippocratic writings, which are absolutely fascinating. And on my blog, you've got an ethic review checklist, you've got a consent form, and you've got a participant sheet that you can use.